So we start out with just the plain regular MediKin like this. And we often ask them just to tell us the different body parts. We just bring the doll out to the patient. They will kind of tell us what is wrong with their doll, why they're in the hospital. From there, whether they tell us it's because they have asthma or because they're diabetic or because they're having a shunt put in, it's easy because we will have all the adapters for the MediKin products on hand. They're the only dolls that we have that are specifically based with different diagnoses, which is very helpful for the kids to see and for the families to learn about as well. The MediKins make it so much easier to help the children understand what they're going to be going through, because it's like having a friend there. It's a friend that looks just like them, whether it be a friend that has lost their hair or a friend that still has their hair. It's a friend that's able to look the same way as them. A lot of times children are afraid to tell us what their fears are because they don't want to upset their parents and they don't want to upset their family. So we use these as a way to kind of help them express their feelings to us. Depending on the age of the child, they may not want to tell us what their fears are. So what we use are these dolls. Can you point to the face like you're feeling today? And we can talk to the doctors and the staff and the family and let them know the things that we're seeing with the dolls and areas of concern and areas that we may want to talk to them with later in an age-appropriate way.
We have found that the MediKins are a huge time saver with the children in the hospital. Even a couple minutes prior to a test or a procedure makes a huge difference. Tracy, I was just in the room with Damien for the spinal tap, and he did perfect. And I was just wondering if you could tell me what you talked to him about.
Sure. Actually, what we did is we used our little new MediKin, and I was able to talk to Damien a little bit about what was going to actually happen during the procedure.
Well, what you guys talked about really made a big difference. He wasn't scared about anything. He came in, he got on the table, he cooperated, and we are used to kids kicking and screaming. It was great.
I believe the MediKins are very unique because it allows the children to look inside the human body. The MediKin dolls help make it easier for them to understand. It helps them get a very good concept of what's going to happen, what will happen, and how they can help themselves get through the condition that they have. Kids are very visual and they need to practice and to go over things over and over again for them to understand.
These are probably the most hands-on type of medical equipment that we can use. The MediKin products are just wonderful in the fact that we could really use them to show exactly what the patient's going to look like when they come out of surgery. And we can add layers and explain that the actual tube goes into the valve of the heart. They can see what their skin will look like when they wake up. They'll see their central line tubes. And we can even put a bandage over here. We can also use them to do teaching.
We have used the MediKins with staff members in the hospital. For instance, if there's a new way to do a dressing change, we'll have them take turns practicing on the MediKin before they try the procedure on a patient.
The biggest thing that I've noticed being able to use the MediKin products with the parents for teaching is it really lessens the stress and anxiety. They don't have to be afraid that they're going to pinch their skin or they're not going to thoroughly clean the tube because they're doing practice sessions on the doll, which is wonderful. And then from that point, they can actually do it on their child and feel confident in their ability to change the dressing.
We have used the MediKins numerous times with children that we have difficulty communicating with. Sometimes we deal with children that speak a different language or children that are deaf. Even if we aren't able to communicate with them, we find that if we walk in the room with a MediKin, the child is immediately drawn to the doll and we can communicate with that child through play rather than through verbal language.
As a child life specialist, I work with many different ages of children, explaining procedures, trying to help them understand what's happening or what's going on with them.
Using the MediKin dolls helps people understand these concepts by using their different senses, whether it's touching, whether it's seeing, whether it's hearing, and using all of those different senses helps them get a better understanding of what's going on in their body.
We have found numerous ways to use the MediKins. It started out when we first got them that we thought the sole purpose was to work with the children, the actual patients, on ways to teach them about things that they're going to be going through. As we were doing that, we realized how successful it was and thought that people besides just the patients would be able to benefit. And we've also used the dolls numerous times in services for staff members as well as students. We'll go into colleges, we've gone into different like kindergartens, different schools where we'll bring the dolls and teach them about certain medical things. We've found numerous ways to use them, and everything we've tried has been successful.